And now we're going to move on to a couple of personal stories of how this technology and our amazing nutraceutical line have truly impacted the health of doctors in the field. Dr. David Feld has been a board-certified obstetrician and gynecologist in Palm Beach for over 33 years. He's a graduate of the 6-year medical program at Boston University School of Medicine and has delivered over 10,000 babies during his career, having completed thousands of surgical procedures as well. But his true passion has always been nutrition and exercise and preventive medicine. He's an avid athlete and at 60 years of age has completed multiple half marathons and marathons, including the prestigious Boston Marathon. And nothing comes close to any of this when compared to the last 4 years of the implementation of the biophotonic scanner program in his office. As Dr. Oz has said, this is the ultimate nutritional lie detector, and recently Dr. Feld and his business partner Kathy Petrillo completed a promotional TV show for ABC as the intro to the new Dr. Oz show. So without further ado, Dr. David Feld, could you tell us a little bit about your experience with the scanner and what you see the future is for Pharmanex?
Well, gee, thanks, Karen. You know, you're putting me how do you follow Joe Chang? You know, I mean, the man is brilliant. I look up to him more than I have ever looked up to any of my surgical professors or anybody else, and I thank him for everything that he does every single day of his career, and he's really helped pave the way for our program. The scanner has made this real. When it became available 4 years ago to me and to other physicians, it was almost like it was too good to be true. And it was very exciting on May 17th when Dr. Oz did showcase it. So we have the ability to measure. We have supplements that are in the PDR that are guaranteed to work. And we have a business model that is second to none. So to make it very, very simple, in the last 4 years, I had never recommended a supplement prior to this because we had no way to measure it. We had no idea what to take. And then what I learned was really between 70 and 80% of all people living in America need to supplement. And 99% of us need to supplement, and 70-80% of the people sitting in front of me are actually piecemealing something together. So the question isn't, do we supplement? The question is, with what? And in today's day and age especially, patients are looking for guidance. They're looking for recommendations. And now we can make intelligent nutritional recommendations. In the last 4 years, my partner and my nurse and I, Michelle, have scanned over 10,000 people. We've looked at somewhere in the vicinity, conservatively, of 300 to 400 supplement combinations. And our premier product, LifePak Nano, just blows everything out of the water. And the main reason, especially for physicians to understand this, the main reason that LifePak Nano works, it's not a vitamin. You know, physicians, I speak to physicians all the time, and one of the first things that they say is, well, Dave, vitamins don't work. And they're shocked when I say, you're right, they don't work. It's a $30 billion hoax out there. But the reason that we have products that work are basically two reasons. Number one, Joe Chang and Michael Chang and 80 to 100 PhD scientists have continued to analyze and expand and experiment, and LifePak Nano is the representation of that. It's the gold standard, and there's two N-words that I teach my patients and other doctors about LifePak Nano. Number one, we have a network of over 60 products, and number two, we have the bioavailability with nanotechnology. Now, in a time, Karen, where you and I both know, as so eloquently stated by you at the beginning, Medicare, Medicaid, insurance cuts, they're getting worse. Doctors are reeling from these issues. We are looking for additional revenues. I've never done anything in my office to produce additional revenues until now. For me personally, it had to be ethical. It had to be evidence-based. It had to be scientific, and it had to have technologic proof. And we have the hat trick. We have the scanner, we have the supplements, and we have Nu Skin Pharmanex. So it's very simple for doctors because they've forgotten their roots. And we have to get back to the basics. talk to Joe Chang. He'll teach you again about the basics of cellular health. 100 trillion cells in our bodies, 500 mitochondria in each cell. We have to get back to the basics, and we have to help influence patient care with preventative medicine and with the guidance that this team has afforded us. And any physician on the line here, I request you do this. If you don't believe me and you don't believe Joe Chang, at least do your due diligence, because you're going to hear from another colleague of mine, Dr. David Rosenberg, and he's going to explain, as I have, that the average physician doesn't do his due diligence. And Karen, you know that as well as anybody else. But this, for any physicians out there, do your homework and understand that this is a gift that we can afford our patients. Thanks, Karen.
Thanks so much, David. It's an honor to have you on, and I know you're very actively on board with our physician referral program and are helping physicians across the country embrace this program and really make a difference in their patients' lives. And now we're going to turn to Dr. David Rosenberg. David is a 1988 grad of University of Miami School of Medicine with a residency in family practice from the Washington Hospital at Washington, Pennsylvania. He's been in private practice in Jupiter, Florida for the past 13 years. He holds several professional memberships and certifications from the American Board of Family Practice, the American Academy of Family Physicians, and the American Society of Concierge Physicians. Currently the medical director of the CareLink Free Clinic in Jupiter, Florida. He is also the medical consultant for the Girl Scouts of America, and a position that he's held since 1998. And the doctor is also the past chief of the Department of Family Physicians at both Jupiter Medical Center and Palm Beach Gardens Medical Center. And when not in the office, Dr. Rosenberg and his family enjoy lots of community involvement and lots of outdoor activity, and it's with great pleasure that I introduce you to my friend and one of our greatest proponents, Dr. David Rosenberg.
Oh, thank you very much, Karen. I greatly appreciate this opportunity to speak to some of my colleagues on the phone who may not have heard what this is all about. And my colleague, Dr. David Feld, who I work closely with, and of course, Joe Chang, who's really helped us, as David stated, get this going. I've always been interested in prevention. As a family practitioner, that's the definition of what we do. We take care of all age groups, and we try to prevent catastrophes and crises. And what I found is my 2 hours of education in medical school really didn't prepare me, so I had to do my own studying. And then my patients, who constantly bring in articles upon articles from all the prevention magazines that are out there on the shelves, really forced me to even do more research because they wanted my recommendations. And what I used to do is say, go to your pharmacy and get a name brand supplement, and that should be fine, until I realized that I really wasn't giving them any more advice than they can get from a throwaway journal. So what I did is I studied, and I found that the company that we're talking about, Pharmanex, had a supplement that had science behind it. And if it's going to be proven, if it's going to meet my criteria, it's going to have science backing it. And so I did my own due diligence. I actually went out to the company and looked at the lab. I looked at the distribution center. I looked at the process that Dr. Chang discussed through standardization and the safety that went into this. And I had a conversation with Dr. Chang once, and I said, what is the most important thing that would allow me to feel comfortable with the supplements that your company makes? And he said, safety. And I knew right there, it reminded me of the first day of medical school when they said, do no harm. That was critical to me. I had to make sure that there was safety in the supplements that I was recommending. Not only that, but I needed to have a way to validate what the patients were doing. And in was the biophotonic scanner is a perfect example of that device. So, it's been very interesting the last 3.5 years that I've had my patients using the LifePak Nano and other Pharmanex supplements. I've seen several changes in them. I've seen not only their scores go up, but as a physician, anecdotally, I see chronic illnesses. And understanding that as a supplement company, there is no way that we can state that we change the way illnesses occur, But as a physician, I see that the amount of health in my practice has reached an all-new level. And my patients come in, and I had a gentleman come in the other day, and he said, I don't know why I'm taking this supplement, Dr. Rosenberg. It's been 2 years. And then he turned to me and he said, you know what? I haven't felt better in my life. And this gentleman's 84 years old. These stories come in every day. But what made most sense to me is not the stories, but it was the science to back it so I would feel safe. And there was another interesting thing that happened 3.5 years ago. As I was trying to improve the health of my patients, my son started going to college. And the way the economy was treating health care over the last decade and the way tuition was going up significantly, I needed another source of revenue. And having run a free clinic for 10 years, I know how important it is to have money to run an organization, not to mention to run my practice. Well, with the added expense, the realities of college tuition for my first child and then my second and now my third in the next few years, the revenue from this program was substantial. And now I call my son's degree actually the Caltech Pharmanex degree. And it's kind of interesting because now that I've improved the health of my practice and my son has graduated, I can then think of the income I get as helping me towards retirement so that one day I'll have the true joy, which is to practice medicine for free to people who truly can't afford it more than I do now. And to me, that's going to be fun. And Pharmanex is helping me to do that. So I want to thank you, and I plan on coming back and telling you more stories of successes that I've had.
David, thank you so much. I really appreciate both you and Dr. Feld joining us this evening.